Y'all be great. Get the third. Yeah.
I did eat before I thought. Yeah. So.
All right, that QR code is back up. If you want to drop in your email address for me, when it asks you what meeting you're attending, you can scroll all the way down to the bottom. It says Gilpin Listening Tour. I do want to provide a thank you to our local woman-owned caterers. Trish from Bright Heart Catering, thank you so much. All right, so my name is Dr. Chelsea. My last name is currently Shore, but I'm getting married in May, so I will become Shore Miller. So just to prevent the name confusion, Dr. Chelsea is fine. I serve as the program manager for the Region 10 Opioid Abatement Council, referred to as Gateway to the Rockies, otherwise known as GROC. I am a person in long-term natural recovery from substance misuse. I am actually a product of the opioid epidemic. I was given an open-ended script of opioids at 15, spent 10 years in active addiction, went and got my PhD, have been in collegiate recovery programs the last 5 years. And so this is a very full circle position for me. Let's go ahead and go around the room just very quickly and give us your name and who you're representing today.
Ray Rears, County Manager. David Rippey, Gilpin County Parks and Rec, Youth Programs.
Melly Ryan, I'm the project manager for State Opioid Consultant out of Jefferson County.
Sandy Hollingsworth, one of the county commissioners, and I'm on the executive committee of GROC as one of the 5 voting members for Gilpin.
I'm Jamie Hollingsworth, and I am Regional Health Connector serving Gilpin County. Lori Larson. What's your position? Community health specialist. Yeah. And I'm Elisa, I'm the director of public health.
And a voting member and exec committee.
I'm Gabrielle Chisholm. I'm with the Compliance Collection Rights. Susan Berlin, Gilpin County Commissioner.
I'm Bobby Butler, I'm the Deputy Chief for Gilpin County.
And community paramedic.
And community paramedic and the care from.
David Jocelyn, I'm the Community Benefits Program Manager for Human Services here by proxy.
Jeff Aiken, County Commissioner, and
Yeah.
Kevin Armstrong, your sheriff, and I am on the GROC board as well and a voting member and a recipient of GROC funding from last year.
Yep.
To help us with our co-responder program.
I am Mindy Leary with the Mountaineer newspaper covering the event.
How exciting! So this is being recorded and then it will be posted to our YouTube channel with a link to the slides. So if there's anything in here that you missed or you want to go back and visit, you'll be able to do that. Excuse me. And if I got your email, then I'll be able to send a follow-up email after with the slides and the link to the recording. So here's an agenda. I do apologize. I am going to be talking at you for the first roughly 30 minutes. But we're going to discuss the National Opioid Settlement, specifically the Region 10 Council, that's GROC, the Advisory Board, our 2023-2024 grantees, our 2025-2027 strategic funding plan, which will lead us into discussing the currently open request for applications. I'll briefly discuss how the GROC will be evaluating itself. This is an ongoing process. And then we'll open up the floor for community discussion about questions you have, gaps, problems in the community that you're seeing, the work that you're doing, and how that connects to the GROC. So the National Opioid Settlement is just that. It is settlement dollars. It is not federal funding. So with all of these executive orders and budget cuts, we are not affected by this. It comes from a series of lawsuits against the manufacturers and pharmaceutical companies of opioids. And the money is rolling. So it's anticipated to be in the ballpark of $40 billion nationally over the next 18 years. It's not a giant lump sum. The Region 10 Council is anticipating somewhere between 20 and 30 million over the next 18 years. Our funding, again, is pretty fluid. And I'll talk about that in a little, in the next couple of slides. So there are additional federal and state grants connected to the opioid settlement that is separate from the regional pot of money. And so money can be braided and blended together. The goals of funding are to abate or make right the opioid epidemic, in addition to prevention of future substance use disorder, addiction, and recovery. So it does support recovery. Funds should be allocated based on equity and needs-based distribution. I know there's a lot of ambiguity and apprehension around the word equity with recent executive orders, but it is a topic of discussion that is very near and dear to the council's heart, as well as mine. So when we think of equity, it is not just race-based, but it is all sorts of vulnerable classes. So white males in a rural area are still a high-risk population and in great need of these funds. So that shouldn't discourage you from applying for a program that supports that population. And again, there's a county, city, and state level memorandums of understanding. So every pot of money functions a little bit differently. I will be speaking specifically to the regional pot today and the memorandum of understanding that Region 10 is part of. Broadly, the spending categories that are approved in something called Exhibit E include prevention activities, treatment, recovery support services, harm reduction, and then there's a law enforcement public safety pot. We do include law enforcement public safety with our planning and coordination pot of money. So this is like your workforce development. So creating internship pathways for students in Masters of Social Work programs to become clinicians in rural areas, specifically for substance use disorder, but then also retain those individuals. Gen Z coming from higher education does not want to work in community public health because there's not a lot of money to be made there. They can go make 4 times their salary in private practice, but the people who need these services the most are often limited to public health and community health programs. So how do we retain professionals in the field? Oversight and accountability. The regional council reports to the Colorado Opioid Abatement Council, or the COAC. That is ran by the COAG, the Colorado Attorney General's office. So we submit a spending plan. They approve it to make sure our allocation is aligned with Exhibit E. And then every year we submit an expense report. We do several amendments, again, just making sure all the money going out is aligned with Exhibit E. So we do have that type of regulation and oversight. The Region 10 Council just approved its standard operating procedures, our first draft. That is a public-facing document that explains how the council operates, how it makes decisions, where to find different types of documents. And then we are also working on a long-term data dashboard for the website that would say how much money came in, how much money is allocated to go out, how much already went out, how many people have been served, demographic information of those people being served. That's probably 2 years down the line because the council has only been in existence for 3 years. It's only in its second round of funding. I joined GROC in October as the program manager to provide that additional support to make things like the data dashboard happen. So we are very much in our infancy, but any ideas that you would like to see in terms of transparency, please reach out to me, let me know. I probably have that information and can get it to you. There's always challenges and considerations, like ensuring long-term impact of programs and not just one-off, we did a thing, so check the box. We want to make sure that what we're doing does create behavioral and attitudinal changes to reduce stigma around substance use disorder, addiction, as well as recovery. And then finally, doing a community needs assessment that's ongoing. I know our procurement office does not like that we do this, But all of our meetings are open to the public, including our review for applications. So when we're reviewing applications, you can attend one of those meetings. There is a specific time in every application for community discussion where you can say that this is completely relevant to you as a Gilpin County member, or this application is not relevant to you whatsoever as a Gilpin County member. Something else we've included in our RFA this year is a letter of acknowledgement. That can come from anybody. You don't need to be an elected official. You can be a retiree just residing in Gilpin County as a community member. And someone decides that they want to submit an application for a co-responder program in Gilpin, and you have no idea who these people are. That would be, and then the GROC funds it, that would be community placed, and that's not something the GROC wants to do. They really do want to fund programs that the community wants and needs by people they trust. So the pots of money are arranged kind of like this: the federal money, the state money, so that would be the COAC. They do something called the Infrastructure Award every year. You have to be a regional council or a participating local government to apply for that. So if you're a nonprofit, you can't apply by yourself. You have to find someone to be your applicant, and then you would be the implementing organization. The regional council, there's 19 regions in Colorado. Again, we're region 10. That's Gilpin, Clear Creek, and Jefferson counties. Then there are county or local pots of money that people can keep, or they can opt out of keeping and donate it back to the regional council. So when I was talking about our funding is rolling, we've done our strategic plan, but then one of these local county people who got money decided that they weren't going to use it all. And we got a $6,000 payment to GROC yesterday, which is really cool. So we have an additional $6,000 to spend. There are implementation partners and then accountability funds. So it does look something like this. Again, there's a QR code if you want to learn more about the 19 regions. GROC is going to be that 60% regional share. The local government share would be 20%. The COAG with the state share for 10%. And then the infrastructure share, again, is also 10%. Money should only be used in the region for which money is applied for. So if you are a Denver-based organization, you provide services in Jefferson County, Gilpin County, and Adams County, the GROC can only fund your work in Gilpin and Jefferson counties. It cannot and should not fund the work in Denver or in Adams County. They should go to those respective regional councils to fund that aspect of their program. The GROC has a 16 voting member structure. So there is one county commissioner per county, 3 total, no term limit. There's 1 law enforcement rep per county, so 3 total. They have a 2-year term limit. It's 1 municipal or county court system rep. This person has to be agreed upon by all 3 counties. And they also have a 2-year term limit. There's 1 human services rep per county, 3 total, no limit. 1 public health representative per county, 3 total, no limit. And then 1 rotating city representative per county, 3 total, 2-year limit. Our quorum, which is the number needed to make any type of decision, is 9. Here's our current roster. This is also posted to our website as well as the state opioid website. So the top 4, myself, Chris Hapgood, John Bundy, and Eric Butler, we are administrative support. So I'm the program manager. Chris is our fiscal contact. He manages all invoices, money in, money out. John and Eric provide legal support to the council. Leslie Dahlkemper is our chair. George Marwin is our vice chair. As chairs, they serve I think it's 1-year limit. And then they progress. So then George, as the vice chair, will become the chair, and Leslie will become the past chair to provide more consulting support, and we'll have to vote in a new vice chair next year. The alternate column are delegates. So if Mayor Bud Starker could not attend the meeting, then Councilwoman Sophia would be his representative and be able to vote for him at the meeting. This is our executive committee. So this is where we have extended discussion about different funding priorities, more administrative things that doesn't need to necessarily go to full council. That would go into executive session. All of our meetings are open to the public and they are all linked on our website. Here's a QR code, so that takes you straight to the work tab that has all of our meetings posted. So you can drop in at any time. The executive session is like if someone was requesting a letter of support, that would get brought to the executive committee for an extended discussion. If the executive committee decided that they did want to support that letter, then it would go to full council for a final vote and group discussion with a strong recommendation from the executive committee. So they ask those more meticulous details. Generally, we meet on the fourth Monday of the month in a hybrid format. Our meetings are all in Jefferson County right now, but we have discussed moving those meetings to rotate physically in Gilpin and in Clear Creek. So hopefully we get to start that in August. I would love to come up here more and engage with you all, but there will always be a virtual option to that. The executive committee meets the first Monday of the month. That is entirely virtual from 1 to 2:30. The best way to get calendar invites is to subscribe to our public Google Calendar. That way I post the agenda in there, any type of minutes go in there, recordings go in there. The virtual link to join the meeting goes in there. If there's ever a change in the meeting, that would go on there. So you can subscribe to that. So here's some additional resources. We do have a website. We are moving to a different website platform, probably in June or July. That just has more functionality. It's more robust, to do cool things with it. We also have a YouTube channel. So all of our meetings are recorded. I've been hosting webinars to walk people through the request for application. Those are posted to the YouTube channel. Again, that public Google Calendar, we do have a public Google Drive. Those are always linked within the agenda and within the minutes so that you can find documents quickly. And then, of course, email me anytime. I'm your point of contact. I love brainstorming with people and seeing what ideas, or even again, what issues the community is facing and bringing that back to the council. The council does follow the national guiding principles for decision-making. Spend money to save lives, don't sit on our hands. But in that same vein, we also have to consider capacity and if that organization is the right organization, if they're asking for a reasonable amount of money or way too much money, and if the program is guided by evidence. And so MAT is an evidence-based project that definitely would qualify, but let's say you are proposing a wraparound where you provide housing for the individual, room and board, MAT service, peer recovery services, but that model as you run it has never been tested. So you have no preliminary data that people don't rescind into addiction, that they do maintain recovery, abstinence, or sobriety in the long term. That would be a high risk project. So the council is not currently in the game of novel, progressive, innovative, high risk programs. They, again, being in their infancy, it really is about true measurable programs that are proven to be successful. There's an investment in youth prevention. So supporting children, youth, and families, again, by making long-term investments. This is not the DARE program or the STAR program. I'm active addiction, I'm a product of that. It is more evidence-based programs that, again, we know long-term are effective. Focus on racial equity. And again, the council does not just limit this to racial equity. The council thinks of equity in all demographic variables, is who is at the highest risk, who has the most need, regardless of race as the only factor. Develop a fair and transparent process for funding recommendations. So that would be our current RFA process. That would be outlined in our standard operating procedures manual that is allowing community discussion. Like I said, the hopes of a data dashboard. Right now, grantees submit quarterly reports. I summarize those quarterly reports and make that information publicly available in a more summarized way. And then consider future sustainability in all recommendations. So in the past, the council was only awarding 1 year of funding with a potential optional second year renewal, potential optional third year renewal. Having been on the ground, that is not sustainable whatsoever. So given that we do a 2-year strategic plan, we are allowing applicants to submit for 2 years of funding with an optional third-year renewal once we get more money in and we know what that's going to look like. Knowing very well that if you are not meeting your deliverables in the first year, the council can choose to cancel the contract after the first year. So we are also implementing learning forums for grantees this year. So hopefully we never get to that point where you're not succeeding. Grantees in the first round did not receive post-award support, which is crucial to implementation. And so we are kind of seeing a drag in implementation, and we want to prevent that in the future. The council does have an advisory board, and this is mandated per the intergovernmental agreement, but what it does is not yet really defined for the GROC. There's 2 types of advisory board members, discretionary and non-discretionary. The GROC also includes current grantees as advisory board members. They have not previously had any type of role. There's no ad hoc meetings, but we do hope to change that moving forward. So this is the first year that advisory board members were eligible to review applications. They submitted interest, including their resume, their expertise, and then they were approved by the to check out and see. Oh no, I was trying to mute my sound, but I think I muted my microphone. You should reach out to the voting member who is closely related to your work and ask them to nominate you as an advisory board member. Then the council would approve you and you serve a 2-year term. Non-discretionary voting members are just granted advisoryship. This is again per the intergovernmental agreement. This includes school districts and fire districts. It's school districts of any size and fire districts of 20 who serve a population of 25,000 or greater. We just decided to give it to all fire districts in Region 10. So if anyone is from a school district, like a school board member or a school counselor, and you want to be an advisory board member, just shoot me an email and your name automatically gets put on there. You do not have any term limit. So I've started to kind of track this. This is not a prescriptive list. This is a suggested guide from the intergovernmental agreement. And it's not limited to 1 person per category. So if you know someone who fits one of these areas, or even just they have lived experience in this field, whether it's a child or a parent or a spouse, they would be great on the advisory board. After the RFA window, we are hoping to make this a more engaging advisory board with some ad hoc meetings, but we're just not at that capacity yet. So these are 2023 grantees. We gave out about almost $1.3 million in the first round. If you click that QR code right there, it'll take you directly to the landing page that talks about each grantee, how much they were awarded. And then again, that summary quarterly report will also be there of, are they meeting the objectives they outlined in their application? Moving into our 2025-2027 strategic plan. So this was set by the council just before I joined. I started in October, but the council decided to allocate almost 14% of funds available to harm reduction, and then 14% to prevention, 12% to planning and coordination. So that would be like the co-responder programs, workforce development, treatment, 31.5%, and then recovery is almost 30%. So I do have the exact dollar amounts right there, but it equates to about $12 million that we have to give out. This also, again, is fluctuating because we got an additional $6,000 that we need to allocate somewhere, and funds roll over. So if we don't use all of our money in this RFA window, funds will roll over into the next plan. And like I said, settlements are always closing, pharmacies are always paying out. We also have the ability to move money around. So if we, for example, in the first round of funding, the council allocated the majority of dollars to treatment, but they didn't get any treatment applications, but they got really strong recovery applications. So they were able to move money via an amendment to the state that just says, we didn't get applications, we want to fund this instead. So that's always an option. I did break down specifically within prevention, treatment, recovery, harm reduction, planning, and coordination. The council has identified their strategic plan for this funding window. Applications outside of this, but still aligned with Exhibit E, are still highly encouraged. There might be a chance that prevention, like youth prevention, is a high priority, but they don't receive any applications for youth prevention, but they receive a really good application for adult prevention. So the council would consider that in funding. The council has also taken out money, 2% admin. And so that would run like our website, any type of catering, any type of print services that we need. I use the Jeffco I team and public affairs team a lot, so they kind of get paid out. And then we have a 3% contingency fund, and we follow a National Institute of Health approach. So this is 3% of the available funds. The contingency fund is not available while the RFA window is open, because we would defer everyone to an application for funding. This really is, we don't have a set policy for this, but when you're thinking of emergency dollars, is let's say you currently have Narcan, you get that funded through the state, there's a spike in overdose rates, you're running low on Narcan, then you would submit an emergency fund request for Narcan to the council, and the council has money already set aside and pulled down from the state to just deliver to you. And then that includes my salary and fringe benefits. And then the council will also be soliciting for an external program evaluator. And that's just accountability, transparency. Am I doing the things that I think I'm doing in the way I think I'm doing them? Are grantees meeting their objectives outside of what I think they're meeting their objectives? So that solicitation is anticipated to open June and July with a review in August. Transitioning into the current RFA, I promise I'm almost done lecturing at you. The current RFA process, so that started with a development of scope and timeline with the GROC Council, creating the contents of the grant application, developing the application in Civic Plus, that's the online portal, and then I monitor all communications. The application will close on March 31st. There are multiple rounds of how this will happen. So Chris Hobgood, the fiscal agent, and I will go through an initial screening, making sure the applications have all of the required documents needed so that if they are awarded, we can start the contracting process, and that they also are a legitimate agency. And then we will sort them into reviewers. Every application will be reviewed a total of 4 times, once by one person representing each county. So one person from Gilpin, one person from Clear Creek, and then all voting members, one from Jefferson County, and then one advisory board member that was pre-approved in January. Everyone has signed a non-disclosure agreement. The initial scores will be average, and we'll look for a natural break. Those above the natural break will move into the next round of group discussion. Each application will have 20 minutes of group discussion. I'm not going to go over that right now because I am going to go over that extensively in the full council meeting on Monday. So that'll also be recorded. But there is a narrative here if you want to go back and look at that. And then finally, how are we, again, being transparent with ourselves? So that would be that evaluation, that external evaluation team. I joined the council in October, and I did a baseline report in my first quarter of like where, as a complete outsider, of like where I thought the council was. That is linked on this slide for you. It's posted to our website, so you can go and review that. But in terms of really like, where is the council now and where do we want to go? That's going to take me another 6 months to figure out, especially going through this funding process and getting feedback. But generally, when we think of an outcomes evaluation is what is our funding going towards? What types of programs? What are the outcomes and goals of each grantee? To what degree are grantees achieving those anticipated outcomes or goals? And then finally, to what degree is the GROC mitigating the opioid crisis in Region 10? Part of that is we don't really understand the degree of the opioid crisis in Region 10 because we rely on public data sets, which we know data suppression happens. So smaller counties like Gilpin and Clear Creek are kind of shut out with those bigger counties like Jefferson and Denver. So how do we get more of that county specific data? That is a longer term question that myself as well as the state are trying to figure out how we can go about doing that. And then we'll also include a process evaluation is that how well is the council implementing its programs? How is it managing funds? And how well is it engaging stakeholders? So part of that baseline review is when I went back and looked at the meeting minutes, there was no evidence that community members attended those. So, and now we take attendance digitally, and then that is recorded of how many total people attended the meeting. I haven't decided if we want to put names yet, like of everybody who attended. That might take up a lot of space, but it's like 43 people attended our February meeting. And then it does list our voting members because we have to meet quorum. So more of those like operations and decision making. Some of this also is in our standard operating procedure that outlines those things. So it's people understand how we make the decisions we do and why. All right, I promise I'm done lecturing at you. So there is a QR code here to our Get Involved page. So we are always looking for people to share recovery stories. The council loves to open their meetings in that work and understanding lived experience. It grounds them in the decision making. We also did an educational workshop on paradigms of addiction and how you can understand addiction from a medical model, a moral model, social identity model. So again, just different ways of understanding the problem. So you can join the advisory board, join the listserv to get emails. That's the QR code there. But now I would like to stop talking and I would like to hear from you. So it's gonna, as soon as that goes down, let me see if I can. Yeah.
A couple things for the history. Some of you know, but maybe not all of you. So when the opioid settlement dollars were being devised and the allocation of them, they were going to give counties money by population and known statistics. Gilpin County was slated to get $1,000 per year for 18 years. So the decision was made to go together, the three counties, and be stronger that way. And so we've already benefited as a county because 267,000, correct? So there you go. But anyway, that was a value added thing. And then for Chelsea, the group was facilitated by a professional facilitation organization, and Brianna did a great job. So she's going out.
She's now with Omni Research Institute.
So it was decided by the board that it made more sense to have a dedicated program manager that could do everything Chelsea's doing. And I just wanted to give her kudos because in the beginning when she started, she was like boom, 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 getting all these things in order. And we're like, slow down. Anyway, and then one other thing I would add is that you mentioned that we aren't really looking at the innovative proposals, but that's not quite right because we have discussed some of them that have come to us, and they're just, it's the measurability of the potential success. So the discussion is how to help them create some measurable outcomes. So maybe they'll come up. Anyway, that's it.
I think by innovative, I meant like we don't know if it would work. Like it's an experimental kind of like idea. That's what I meant by innovative. Yeah, if you have a big project, definitely. And the council will be encouraged to really consider ideas, not necessarily an application as it is presented. So if there are issues with the evaluation component of the application, the council will be encouraged to just express those concerns And if they love the idea, fund the idea, and allow me to work with the applicant during contracting and in those quarterly learning forums to build up that evaluation capacity.
Nudge about, who can speak to impacts and something that you see as a true need that maybe we're not meeting yet, and then that might lead to someone saying, oh, I know someone that could apply for GROC funds to help fill in that gap.
I was wondering about, Narcan and they available at our school bus drivers training those or actually, I don't think you need that training. My daughter was only carrying one. Talk about how people keep Narcan back from, NOD. But I was wondering how accessible or whether,
We can answer that first.
Okay.
Narcan is available through public health, and we make that available to all of our first responders, to the school, to, base camp, to the library here, so. we can do that.
And a bill is currently at the state level. I actually got to review it. That would waive the training requirement to carry Narcan specifically for schools. I don't think you should blanketly waive the training. If the training is available and you can go, you should go. So I did suggest some language adaptations in that. But if you don't happen to go through a training and you administer Narcan, that you're not liable.
I don't think it's available on the buses. That's a district decision. It's available at
and the training's 15 minutes on one.
Yeah,
So it's not that.
it's not that hard. I think I see the value in the training is more, what do you do if that first hit of Narcan does not work? How many Narcan bottles can you administer? And then really, what do you do immediately after? Like you think about CPR, you have to renew that every couple years because there is some type of emotional training that you do. If you do it enough times, then you don't have a panic. So I do think there is value in training, especially for youth, of just like, oh, what do I do now? Like, okay, you woke up, that's it. Bye. Great.
Very helpful to have training in that regard. We're running into this issue quite often because research is kind of contradicting what really happens in the field. So if you go and read like some of the MRE research, it says, go ahead, give people 4 milligrams of Narcan to feel. Well, it creates a horrific problem for us because Narcan immediately sends people into withdrawals. So we immediately start having to deal with that on our end. It can also create flash pulmonary edema, so people become profoundly, sick from that. So there's some misconceptions that are out there that we're trying to figure out how to mitigate because it's hard for me, one little deputy chief of the ambulance, to compete with the research that, a facility like Emory and those are putting out. But I guess my point to this is we want people to know that Narcan is important and it works, but it does not come without some kind of secondary consequence to it. So, so we unfortunately recently we've had several casinos that now have it in their facility and they're giving it, and then 3 minutes later they're giving 4 more, and then 3 minutes later they're giving 4 more. And by the time we get there, we're physically fighting someone who is in active withdrawal and our whole police see us. So.
And then what I was gonna add was, I think there needs to be training on how to identify if someone might be in a drug overdose versus in a diabetic coma or passed out due to another medical condition. So Narcan is all well and good and it's widely known, but you need to identify something to know if it's needed or not. And I haven't seen any training.
To address some of the gaps in the community, we, what do I say? For those who don't know me, I've been a paramedic for 38 years and I retired from the city of Denver. I've lived there for most of my life. Started my career here and I'm ending my career here. So, what I found is the gaps that we found from Gilpin Ambulance has been resources. So we have developed a couple of different programs that are we're trying to roll out that are going to help us integrate and help human services, public health, senior services. We started with a CARES program, it's community assistance, resource, and education. So we can go out and help people identify dangers around their home, help them reconcile their medication. Well, our ultimate goal leading into GROC is to hopefully become a community paramedic program. So now, once we become a community paramedic program, I can actually go into a residence and I can work with my physician advisor and the patient's doctor to continue their treatment plan. So this is someone who's an active recovering, in active recovery that needs medication given. Instead of relying on this person to get to the doctor, if they can't have that. As long as their doctor's willing to work with us, we can go into their home and help them. Problem is, with some of our board members that are commissioners as well as board members for the authority, is community paramedics are not reimbursed. We're allowed to get no funding from Medicare, Medicaid, and no insurance company will. So everything that we do has to become secondary to grants, money rolled into a budget, and things like that. There's legislation out there to help create that. However, we're years down the road before that happens. Secondary leading into that, when it came to resources, we also realized that the mental health crisis associated with whether it's with opioids or just mental health crisis really taxes first response systems here. The sheriff's department, it taxes Black Hawk police, and it really taxes Gilpin ambulance as well. So over the last year, a discussion we've been having with Sheriff Armstrong and Chief Moore already from Black Hawk Police is to actually develop a secure vehicle transport program. So that would include just a cage car, if you will, with the right client, meeting the right criteria. We can transport them in that secure vehicle transport to Jefferson Center for Mental Health. The one thing I've learned over my long career is the emergency room for someone who is simply in mental health crisis is the wrong place for them to be. They go in there and they essentially go, "You don't want to hurt yourself anymore? Have a good day." And that's it. And they don't get the care that they should. So being able to take folks to Jefferson Center for Mental Health and get them started in the right place is also part of our goal. So these are the projects that we're working with the Sheriff's Department and Black Hawk Police, and we'll approach our board once we're submitting a grant to GROC as well to help with the secure vehicle transport, community paramedic program, and our various other programs to help get the boots on the ground to help our partner agencies here that don't have, a plethora of resources, but they need the help. We don't have all the resources either. We're just a cog in the wheel. So those are the things that we identified after public health did the community needs assessment. And from Gilpin ambulance perspective, those are the things that we're looking at. With.
No, I'm cool. Yeah, to give you a little background on our code under program. Our research a number of different programs. You got the programs in which you have a co-responder or a clinician that actually lives in the law enforcement and even responds to calls of service for people who are suffering from some type of mental health crisis. The other one is a paramedic process or program. I actually reached out to sheriffs in Wappo County and off of Wappo County who do a telehealth program, and that's the program that we've gone with in here in Gilpin County. The reason being is that we don't have a volume of mental health calls in Gilpin County that would warrant a full-time or even a part-time clinician or mental health professional be within the sheriff's office.
So what we did is we reached out to GROC, we needed help in getting what we call mobile data computers in our poll cards. To be able to also have, because the connectivity up here, everybody knows that it's a challenge up here. So we needed to make sure we work with AT&T, T-Mobile to get that connectivity that we need in certain locations in the county. What we do is we do that telehealth with that computer, with that individual that may be in that crisis. Now that it could be just if they need to do a follow-up the next day, or it could be a transport based on the information that is worked, because we work strictly with JCMH and have a 24/7 phone number that we can call for that service. And they help make that decision on what's in the best interest of the individual that is in that crisis. So the transport piece works well for us in the sense that I may have 1 or 2 officers on the road. That would take 1 officer off the road minimum for 2 hours. This transport would really keep that law enforcement officer in the community, to be able to respond to emergencies and call for service in our county, as opposed to just one. So that's the discussion that we've had with Bobby and his team and everything. But this is a pilot program for us, because we want to see how this works and how it if we need to improve it, and how we can do better to serve these individuals. One of the biggest things that in my, I've been a CIT, crisis intervention trained individual, and when I was at Wheatridge, I was a coordinator. One of the biggest things that we have to have is we have to have follow-up with those individuals. You can't just give them the telehealth and just say, okay, have a nice day. You have to have the continued follow-up with that individual to help them through that crisis. That in itself helps us from being able to be constantly responding to that individual's needs. So the follow-up piece with JCMH is a critical piece that we have worked with them on that. So that's the co-responder program and how it got to where it is now. We just got some of the most of the vehicles installed with the local software and the hardware. So now we're working on policies to make sure that we understand how this is all going to work and get it going.
Robin, I know it's a pilot program. Do you mind if I ask a question about what you just said? So a lot of our potential clients for opioid drug abuse, drug addiction actually come out of the casino district in Black Hawk. I would say, and I think you guys would agree with me, that the majority of them are going to be affiliated maybe with the casino, or a lot are. And that's Black Hawk PD, not Gilpin Sheriff. So is Black Hawk PD going to also be involved in the Jefferson Center, connection to triage where they need to go? Is there any coordination with Black Hawk PD on this?
The policies of the working.
Okay.
We do service Central City, so we do service the casinos
Right.
as well. So Shelley Moriarty and I have Michelle before Chief before I've known her for 30 years. I've known her for a long time, and her and I have been working on that as well.
Good.
She understands the pilot program, because if it's not a pilot program, then they have to implement the same thing.
And then the other question I have, and I know it's pilot, I know it's early days, but is the model that the officer connects the client, the patient, directly with, they're doing like almost like an intake or an evaluation, like right then and there on the spot for that triage portion, like you said, to determine where they need to go. So is it like if the equipment's in your vehicle, I'm just curious, like how the patient actually connected to Jefferson Center. Is it a phone call with the officer?
It's just like your Zoom.
Oh,
It could be a Zoom call with the connectivity.
Yeah.
It's what they call a Panasonic tough box.
Okay.
And you can pull it out of your car, take it into the residence, and set everything up in there.
Okay.
And they can do that.
Yeah.
Process.
And are you guys doing the same thing, or is it something like sheriff?
So we're working, and they handle both, because in the state of Colorado, I have absolutely no legal authority for a mental health crisis. I cannot put anyone on mental health hold. I can't put them on a 0.5, transportation hold. Everything is going to come from them. However, we do have an agreement with Jefferson Center for Mental Health, which is what prompted us to start thinking about this secure vehicle transport. Is I'm in the same boat. If that person just requires a transport, it keeps me from having to send an ambulance, down as well. So that's what we're looking at. Then to come back around to that was the community paramedic aspect of this. If we're able to work with whoever's involved, whether it's, their addiction counselor, their profession, their medical doctors, having that piece in place also helps us in the long run if we can prevent continual 911. And prevent repeat, visits from the sheriff's department. We can hopefully continue to provide them the care they need without the impact to 911 services that, we're all struggling to make sure we're providing.
So I think one of the other pieces there too, somebody may be having a mental health crisis, doesn't mean that they also have opiate issue. However, people that have mental health crisis and everything, will self-medicate to take care of those issues and problems that they've got. And it could be opiates that are part of that. So that's why it's important to have that telehealth piece in there for them to be able to diagnose or to assess the situation, what's in the best interest of the individual that we are interacting with.
And to answer, we do have the option and have been told from Jefferson Center for Mental Health if we want to call and have the same kind of interaction they're having, we can. We've opted not to because it's not our wheelhouse. It is our wheelhouse, but not our wheelhouse. The officers are the ones that have the authority and the ability to put someone on mental health hold. So it makes more sense for them to interact with Jefferson Center for Mental Health and us to handle, all right, this is what they say. And it's up to us as a group to work together on how that patient gets where they need to go. So
I do want to mention here too that it's opioid settlement dollars, but they can be used for co-contributing variables. So low socioeconomic status, history of mental health crises, housing insecurity, all those things that factor into recovery capital. So it doesn't necessarily have to be a point blank opioid project.
And I just want to say, I got a real good access with Jefferson Center because Jefferson Center serves the state 3 counties. So there's a lot of coordination between the communities that things do. And then up here, Jefferson Center has clinicians in the jail, they're in the school, and they're at
to Jefferson Center or whatever facility. So
And I agree 100%. I want to say that change.
it is. And we also ran into some of the issues that Sheriff Armstrong has run into is that, we're looking at our call volume all the way to simple things. And it's totally off subject, but blood products are now on the ambulances. We don't have a call volume to support it. So we're same thing as, a lot of the mental health, a lot of the opioid crisis. You're 100% correct from the EMS standpoint. I'd say 90% to 95% of the folks that we're dealing with the opioid problems are in Blackhawk, but they're in the county, we're just not recognized. We don't know them and we don't.
So how do we get that data? That's a big gap, right?
Well,
So between human services, paramedics, sheriff's department, public health, how do we fill that gap?
Well, part of the problem for me is I'm bound by HIPAA, so I can't just come tell you. And two, a lot of people aren't just gonna call, and say, hey,
Right.
So I'm talking future, and I'm talking things that are never gonna really happen. The only way we're ever really gonna identify everyone is as soon as we take away stigmatism away from the fact that you're an evil, horrible person by having an addiction. And we're millennia away from that. So mental health, absolutely. So I think for an EMS standpoint, if we could get the public to realize that we're here to help them in some way, shape, or form, even if we can get 2 or 3 more people involved that we didn't have before.
That is a larger conversation most of Colorado is in rural areas. There's a rural opioid council facilitator cohort that meets monthly, and we have these conversations. So the state is looking at how do we measure that, how do we get that data, and then also that will be included in our program evaluation solicitation. So hopefully having a third party that is like what they do is draw on that data would be helpful. And then also the more people we fund and grants we get out there, the more evaluations we get, and then we can kind of like piece that together.
Linking up to the sheriff's office, site visit.
Yeah.
January.
Yep.
February. And I had a discussion with you guys about what I thought there was a gap. And that gap is in our school. How do we reach our youth to not only talk about their parents who are maybe addicted, so that we can break that cycle somehow? And how do we build in a program into our school system to do that? And
Well, obviously, I'm an advocate for Parks and Rec, right?
yes, ma'am.
So we do a lot of programming for youth after school, summer, weekends, that kind of thing. And then obviously just recovery for folks if they are feeling better or want to start socializing again or physically wanting to do things to help their mental health. That's why the community center here feels it. So we are getting some grant too. Mostly to keep doing the good work we're doing for our after school program and the teen program, and transportation is a big barrier for us sometimes. But I would love to see how Parks and Rec or even the library, how can we help with that preventative aspect, the recovery aspect. Obviously, we're not going to be responding to these folks, but we might need to. I might need to give Narcan to somebody, or I might need to call the sheriff's office for something several times. But yeah, I'd love to keep that conversation going. So.
And I think it's important also in the school itself.
Yeah.
As well.
Yeah, I think the social aspect of prevention for youth is a little bit different than prevention education and prevention education training for youth. So I see where you sit really well with that social component. But I think adding in that school-based conversation of education and training is specifically what Kevin is talking about.
Mm-hmm. With one of our current grants, we are going into doing a lot of evidence-based teaching curriculum in the school, but keeping that going. How do we keep that conversation with the school going, and how do we keep more?
In conversation, I think also you have a parent who is addicted.
Yeah.
How does that child cope with those issues, so they don't fall into the same trap
100%.
to break that cycle somehow?
Mm-hmm.
So what are those programs? I'm a cop. I don't know much about addiction for youth or programs that can help assist them. But I think it's a gap that we have in Gilpin County that we need to really focus on.
I know that Sarah Casano in Clear Creek has brought up a similar concern. In Savio House, they serve multiple counties. They're based in Jefferson County, but they do a lot of that family programming. So I did connect Sarah with Norma and Josh to talk about like what that would look like to do more community specific training, not just how they have it in a therapeutic setting. So that might be also an option, is to like branch out and see what Sarah comes up with and get it replicated here.
Let's see, I because you don't know, Gilpin's kind of, I won't say the name because it's not really moving, but Gilpin is served by 2 school districts.
Okay.
So they talk about the school, that means the one physically and go.
Oh,
already
okay.
but no, we have, the school that's in Netherlands. And so about half the students go to one and half go to the other. Somewhat it's by where you live in the, so we have, we were or two as far as I know that the least in public health has really been actively trying to work with both schools. So I just want to point that out in case you didn't know that about them.
Yeah, so Nederland is Boulder County, right? So there are options to do regional council collaboration. So Region 8 is Adams County, and they've been pretty persistent about coming up with some type of collaboration with Region 10 because they use a lot of resources in Jefferson County. So both councils identified sober living as a priority. So I'm actually hosting a virtual brainstorm meeting with all of the sober living organizations in Region 10 and Region 8 to see what a collaborative would look like. So it might be, and this is so rough draft idea, is that they submit their RFA one time in both regions, set aside a pot of money, and then they kind of just have like this ongoing like scholarship fund once they're approved to be in. It came up at Jefferson County to get the treatment centers to do something similar, is what would collaborative treatment center program look like? How can we get the treatment centers to partner with sober living? So I can definitely reach out to the Boulder County program manager and see what they're doing with their schools and see if there is an educational collaboration that we can come up with. Something that the GROC has not put in process yet is a special projects fund. And so what would, if councils, voting members have this special project that they would like funded, what is the process of getting funding for it? How does that evaluation work? We don't have that yet. I'm drafting some ideas that we could put that into policy. So maybe this school between Region 8 and Region 10, specifically for Gilpin, is something that could go into that.
As a parent, I doubt my kids have been in both schools at one time.
Okay.
But the majority in Boulder Valley School District, and they do have a lot more, I guess they call it their living or life program that they have ongoing, and they do talk about more sexual as well as other dynamics, mental health dynamics, addictions, and those types of things.
Mhm.
We, even with our program, we did get a here in the county, that program, there was a little bit of pushback about concerns from some of the parents in Gilpin County, it being too, I don't know how to put it, but they did
Aggressive.
how things going on, they felt that that was more of the parents' prerogative. So, you know, that is a little bit of difference there to kind of to be cognizant. You know, it's just kind of culturally, there's a little more conservatism in terms of what they feel they should be getting from community programs versus their home. And then VBSD handles, and they're able to do more progressive types of life skills, like it is built into their physical education.
Very cool. Thank you for that.
Yeah, gives it a little bit of perspective too.
Yeah.
They handle things like
Or- I know it's a challenge.
It's a
not gonna
challenge,
be easily well by all people.
I think that goes back to
Yeah.
that stigma conversation. Yeah. So I do want to be mindful of time. We are 3 minutes over what we had said. We were gonna go, but this is a great conversation. Is there any like last minute questions, comments, concerns, thoughts? Thank you. All right, so our full council meeting is on March 24th from 1 to 3. Again, that is hybrid based in Jefferson County, but I hope you all can join virtually. I will be posting this and sending out a follow-up email. So if you did not check in, please make sure that you check in or I get your email in some other way, shape, or form before you leave. Thank you all so much. I will get you. Yes.